Hello, I'm Dr. Ruth Roberts, and Esau and I are going to demonstrate some very basic passive range of motion techniques. These can be used to help improve mobility for a dog that either already has arthritis or for a dog that you're trying to keep in great shape. So the first joint we're going to work with is the shoulder, and you want to support the shoulder with one hand and then gently grasp the upper part of the arm with the second hand. And we're going to work through normal range of motion. It's called passive range of motion because we are moving the dog's leg. Esau does have some shoulder discomfort, so his range of motion will not be full, but he'll also be able to show you where he begins to become uncomfortable, so we can take him into a more gentle and tolerable passive range of motion. Again, grasp the shoulder with one hand, and the upper arm with the second hand, and we're going to flex and then extend the shoulder. And right there is where he begins to become uncomfortable, so we want to take it back away from that area of discomfort and gently work up into it, hold it for a few seconds, and then pull it back into extension. So over time, what will happen is we can help him improve his range of motion and get him to relax a little bit more so that he doesn't continue to hold that joint in a limited range of motion and re-injure it more. So we're very, very gently pushing forward into extension. Good job, buddy. So the second joint is the elbow. And again, you want to support the elbow with one hand, and then with the second hand, gently grasp the leg. We're going to bring it into full flexion. And again, he may have a little discomfort here. And then full extension. Easy, pal, easy. Easy. And repeat that several times. Again, taking him right to the edge of where the discomfort is, holding it for a few seconds, and then moving the leg in the opposite direction. Good job, Bubba. And with the wrist, again, support the wrist with one hand, and with the second hand, move it into full extension, and then full, gentle, and then full flexion. If a dog is particularly sensitive in their toes, this may be enough to kind of get them goosey and moving around, so try to hold right in the center of the foot. Again, into extension and flexion. Good job, buddy. The rear leg is very similar, of course, three major joints: the hip, the knee or stifle, and the hock or ankle. So again, we're going to support the knee with one hand and kind of put your hand over the top of the hip so you can feel where things are. Gently extend and then flex the hip. As you work with your dog, you're going to see more mobility develop. If he stops you, if your dog stops you, then just respect that, hold it where they're just barely uncomfortable, and then move it back in the opposite direction. So he's now letting me work through a fairly normal range of motion in both flexion and extension. The stifle, same thing we did with the elbow, so we're going to support the stifle or the knee with one hand and then grasp the lower leg with the other and gently work through that extension, again to the level of your dog's comfort, and then flexion. So, and this way we've isolated the hip, so if they do have discomfort in the hip joint, we're not moving that at the same time. So again, flexion, extension, and you want to repeat that 5 to 12 times based on your dog's level of comfort. And then the last joint is the hock. Again, support it with one hand, and then with the other hand, gently move it through flexion and then extension. And again, repeat that 5 to 12 times based on your dog's level of comfort. Again, I'm Dr. Ruth Roberts. I hope these passive range of motion techniques will serve you and your pet well. And if you have any comments or suggestions for topics you'd like to see covered in the future, please leave us a note below in the comment section.